Hey parents, has your child seen a chiropractor, but the results maybe fell short of your expectations? Maybe you're already under care and are loving it and are also wondering if there's more, if there's a specialized approach to pediatric and family chiropractic that might be even better and more advanced way of caring for you and your loved ones. All chiropractors are licensed to care for kids and families, but the truth is that not all chiropractors are equipped to help children, especially kiddos with complex neurological challenges like sensory processing issues, ADHD, or other chronic health concerns. There's a big difference between a pediatric chiropractor who has advanced specialized training and education, and the big one, clinical experience, to be able to care for these kiddos who require a more specialized approach. There are core components that determine whether your child is getting the right care. They might seem simple, but they make all the difference. And maybe you're already under care and just want to confirm, hey, am I in the right place? Because for a lot of you, this video will confirm that you are in the right place. But healing does take time. So this video might catch some of you during a point in care that seems like there is a plateau or you're in a little bit of a regression. And those are pretty normal events and to be expected when you're going through natural, drug-free, nervous system-focused chiropractic care and just natural healing in general. So if you need help with those scenarios as well, just comment below, send us a DM. We can dig into those things a little bit deeper. But let's jump into today's video and discover the 5 reasons or differences between a truly dialed in, advanced, specialized, neurologically focused pediatric chiropractor and other chiropractors who are maybe not at that level. But before we jump into those 5 differences, I want to set the tone with a relatable story. Let me tell you about Henry. Henry was a young patient who came to one of our PX Docs offices after trying traditional chiropractic care. Henry struggled with intense sensory processing challenges. For running full speed into walls for sensory input, having extreme reactions to clothing textures, and he struggled with impulse control. His previous chiropractor provided care, but without a neurological focus and proper frequency, Henry's underlying issues weren't being addressed. After just 1 month of specialized neurologically focused care, his mother noticed profound changes they hadn't seen before. His sensory seeking behaviors became less intense and more manageable, and his overall regulation improved dramatically. So let's jump into the 5 key differences that allow so many kids and families like Henry's find the results they're looking for. And it all starts with how a chiropractor is trained. Do they have the advanced education and training that really does make a difference? Most chiropractors have advanced training in spinal care, musculoskeletal care, back pain, neck pain. That's the typical foundation. And for this video, we'll call it the standard, more traditional form of chiropractic care, which is truly amazing and is so beneficial to help back pain, neck pain, sports and soft tissue injuries and whatnot. And it is significantly better than going the route of opioids, surgeries, and other interventions. The research speaks for itself. But when it comes to taking care of kids, pregnant moms, and families, this requires an advanced level of additional training because most kids, pregnant moms, and families aren't just dealing with an injury. They didn't just throw their back out or they're seeking help for pain. Today's children face what we call the perfect storm, with unfortunately high levels of stress and toxicity building up early in their lives and causing over 50% of kids today to be chronically sick and struggling with complex health conditions. Stress, tension, and subluxation stay stuck on their system. And what we know now about subluxation is that it's not just a spinal, musculoskeletal, or structural problem. Subluxation gets in early and causes a child to stay locked into nervous system dysfunction, dysregulation, and something called dysautonomia. So it negatively impacts the foundation of the nervous system and therefore the quality of development a child goes through. Because if they're stuck with subluxation, stuck stress and tension, they're going to favor that colicky, constipated, refluxy, pro-inflammatory side of the nervous system and continue to develop in that way. And that's why, as a doctor who is caring for your child, we need to know about that. We need to understand that and know how to address it. And that's why it's so key and crucial that your chiropractor has advanced pediatric training so that they have a deeper understanding of developmental milestones. They're well versed in nervous system function, brain development, the gut-brain connection, neuroinflammation, and so much more. And that's where our second point comes in, how experience matters. While a lot of chiropractic practices in your community may have family in their name and see a few kids here and there, You're really looking for someone who is fully focused on pediatric and family care and has a high level of experience taking on tough, complex cases like sensory processing, ADHD, autism, and even things like seizures and special needs. Because having this level of clinical experience allows these types of doctors to take on family wellness cases and things like colic, constipation, chronic ear infections, and so forth with much more ease and excellence as well. You're also looking for an office that is fully focused on kids in terms of the office environment, the layout. Pay attention to, hey, does this place look like it sees kids? Pay attention to the people in the waiting room. It should be a place that's full of kids and kind of like a daycare in a good way. So experience matters. And the third point and key difference to finding a nervous system focused pediatric chiropractor is that they don't just talk about it, but they use advanced technology and neurological testing called the insight scans. Insight scans allow us to find nervous system dysfunction, dysregulation, and subluxation with ease and accuracy. These scans are entirely non-invasive and take just 15 to 20 minutes, yet provide more info on the real root cause of your child's condition than any genetic testing or lab work could ever sort out. And it's not a one and done scenario. We continue to run these scans as care progresses, making sure that real neurological change, healing, and restoration is happening, and that we are restoring nervous system function and optimal neurodevelopment for your child. We can track neurological reorganization and healing through these insight scans, and that is key to healing, because if we don't have the neurological insight scans, then all we have is symptoms. And if all we have is symptoms, then we're no different than medicine, where we just judge care based off of when the symptoms went away, if the symptoms went away. And yes, we want the symptoms to go away, but we also want them to stay away. And we want to do it in a way that restores neurological health and it allows for healing to take place. And the way to track that process is through the insight scans. So it's so important in order to create lasting changes and full neurological healing that your doctor is using these objective measurements to assess and track the nervous system's progression in healing so your child can get the care they need and deserve. So education matters, the experience matters, the way in which the nervous system is objectively measured and tracked matters. And that brings us to the fourth point regarding how your child is cared for. Specifically, what is being used to influence their nervous system? What technique is used, or simply put, how are they being adjusted? Because the truth is, each child's case is unique and requires a personalized approach. And most chiropractors only practice one singular technique. And while that helps above 80% of their client base, it often limits the results in tougher, complex cases. Your doctor being trained and well-versed in multiple adjusting techniques matters massively for pediatric related results. Not every kiddo has the same challenge, and while most kids will, not every kid will respond to one style of adjusting. Is it gentle? Is it specific? Is it enough, but also not too much? All of this matters. And that brings us to the last point, the last of the 5 key differences we're covering today, is how care planning matters massively as well. Not just how your child is adjusted, but how frequently and for how long. Today's children need more intensive care plans than previous generations, because today's children experience much more stress from the perfect storm, which is that stress early in utero, more emotional stress that causes baby to wire in a more stressful state, leaving them more subluxated, more exhausted, all before they're brought into this world. And then in labor and delivery, there's more physical birth trauma, more C-sections, more vacuum forceps, and other interventions. And if that didn't tick off their nervous system off even further, they're then presented with more toxins in early life, more antibiotics, more V's on their schedule, more medications. You get the point. Our kids experience stress on stress on stress. And if the nervous system never gets a chance to breathe, never gets a chance to chill out, actually detox, let go of that stress, and get back to healing mode, if that doesn't happen, then they stay stuck. And that stuck stress impacts their further growth and development. And this is why the dosage, quote unquote, the frequency, the duration of chiropractic that your child is getting matters tremendously to getting healing back online. If we don't do enough, if the frequency is too low, it's not getting to that deeper level of healing that may have happened during the perfect storm that we need to get to, that got stuck in that child's nervous system. Before we can get a nervous system that is regulated, it is often that we have to first go through a process of repairing and retraining the nervous system. And that's why we've seen with some of our patients who have seen other chiropractors in the past and haven't quite broken through to that deeper healing, is because the care plan of how often, the frequency they were getting adjusted, and how long, the duration of that care, wasn't set at the right number to get them that neurological restoration and healing they were looking for. So parents, moms, and dads, if you've already tried chiropractic care for your child and family and it just hasn't worked out the way you want, please do not give up hope. All of the clinical details we covered in this video and more really factor into play when it comes to getting results with chiropractic care. And it just may mean that you haven't found your family's just right chiropractor just yet. At Rising Health, we specialize in neurologically focused pediatric care. We utilize all 5 of these crucial elements of care to help children thrive. And we invite you to experience the difference that proper pediatric chiropractic care can make for your child. Take the first step today by visiting our website or clicking the link in our bio to learn more. Your child deserves care that's specifically designed for their unique needs. Take that first step. We're here to help. God bless, and we'll see you in the next video.